Go live.
Okay.
All right. Good morning, everyone. Good afternoon, good evening, depending on when and where you're watching this Facebook Live. This is the voice and the face of Dr. Tolu Olabintan. I am the CEO and the co-founder of Living Spring Family Medical Center here in the amazing city of Mansfield, Texas, which is close to Dallas, just in case you're wondering. And at Living Spring Family Medical Center, we believe in helping our patients live long and well because we believe the quality of life is just as important as the quantity of life. That is why we're here. We're having a Facebook Live or actually a StreamYard Live discussing with Dr. Makda Majette. Did I pronounce your name right?
Yes, you did. Great job. So, hi, everybody. I'm so excited to be here with Dr. Tolu and to be here in front of all of you to discuss self care. And I'm Dr. Makda Majette. I'm in Miami, Florida,
Mhm.
and I am a family medicine physician, and um, I'm here to discuss with you all self-care, which is so important,
Mhm.
and also to give you guys some tips at the end of this talk that you can find in the link. It's going to be a link that Dr. Tolu is going to share with you all about self-care tips that you can start today, which I think will change your life and help
Yes.
ease yeah, make you feel more relaxed and help ease stress. Did you know that there's so much statistics about stress at work and burnout these days? And I just saw a fact today that actually the people most at risk for burnout at work are women
Yep.
and people under 30, which I was really surprised that it's the younger generation that are really more affected by burnout and stress at work. So hopefully you all will really benefit from some of the self-care discussion that we have today.
Oh, they're definitely going to benefit. Now, for
Yes.
those of you who are watching live, hashtag live. For those of you who are watching a replay, hashtag replay. And our topic today is, Doc, how do I practice self care with all that I have to do? That's a very valid question. Dr. Makda has already introduced herself, but Doc, I wanted to ask, why do you do what you do? Why do you what was your story behind you being a physician? How did you come to all of this?
Yeah, so, I'll try to sum it up because it's a long story, right? We all have a long story of our path and things that have happened. But for me personally, I'm one of the first doctors in my family. And the reason why I chose this path was because I really enjoyed using my knowledge to improve people's lives and to help them feel better. And science was my key topic that I was very passionate about in school. And I also love communicating with people and learning about their stories and learning about their history. And I feel like every person, regardless of age, income, they have something valuable that they can share and you can learn from,
Mm.
and wisdom. So I really appreciated that, and this was the only field for me. That's why I chose family medicine, because if I felt like it was nice, I can have continuing relationships with patients from all walks of life. So,
I
yeah,
love it.
that's why.
I love it. So let's get right into it. What is self care and why should we care?
I like that one. So, self care, it's interesting because I'll give you my definition of self care. Self care are is the things or habits that we do that uh, that fill our cup, that provide resources for us to improve our well-being or our wellness. I actually also looked it up just in case. And so Merriam-Webster was saying that self-care was healthcare that you provide for yourself without a physician. And I was like, hmm, like like the at home testing kits and things like that, and over the counter medications.
Interesting.
Yeah, so they were very specific with that. But I really see more about, it's the habits and things that we can do to fill our cup to help us endure the stresses of life. So that's how I see it. And then why should we care is because life can be stressful, right? We're going like no matter the time period that we're in, there's always going to be different events that happen that can cause stress. There's always going to be um, something that is
Mm.
beyond your control that's going to affect your life. So you have to have these self-care techniques to kind of give you balance and peace and endurance to go through all of those things that you have to go through in life.
Okay, so I have someone who's watching who's like, yeah, yeah, yeah. I hear about self-care. You don't understand my world. I do this. I do this. I'm a single mom. Or I'm not a single mom. I'm doing this. I'm doing that. I have wear so many hats. I'm the one that people come to because I hold my community together. What would you say to that person who's saying self-care is not for me because I'm just there's just too much to handle. And I guess my question with that would be like, how do you know you need self care? Are there red flags that your body tells you, or you like, okay, this you really need to prioritize it. Like you're in a red flag stage. What would you say to that, doc?
Right. So, the as women, a lot of us are caregivers. It's just in our nature, right? In a lot of in a lot of, not all of us, but most of us are sometimes caregivers, if not for our family, but maybe our friends, or you have some community involvement. So it's so important to also care for yourself, because you may notice some signs that you're becoming maybe more irritable, you're not sleeping well, you're feeling like, oh, I give to everybody and nobody's giving me anything back. You start maybe feeling resentful. Um, those things are all signs that you need to practice more self care and compassion, so that you can give to others in a more meaningful and a better way. Because people don't, it's all relationships. It's always a give and take, right? So if you're giving and giving, and you don't feel it's reciprocated, it may lead to some resentment, unless that you're really filling your cup.
Mm, mm. I have to say I've lived that phase. I remember, like almost like throwing pity parties for myself where I'd cry and say like, wow, I seem to be doing a lot for everyone and no one seems to care about me. And the truth is, what actually helped liberate me was it was a Bible verse and it says, love others as you love yourself. My goodness.
Hmm.
Because I thought self-care was selfish and against mm, woman nature. But it's so profound that you cannot pour out from an empty cup. I know they say that a lot, but it's so true. And people demand of you without your permission
Hmm.
as a woman, as a caregiver. You don't need to say, I permit you to take from me. You just ooze it out. And if you don't do this, the people that you're very concerned about suffering will suffer.
Hmm.
Self care is very important. So, someone who's watching, I want to encourage you. What Dr. Makda is saying is very powerful. It's key to you thriving. It's key to you finding joy in the day to day. All right. So, just want to drop that real quick. My next
I
question.
love. Okay, I love that. I just want to add something to that really quickly, Dr. Tolu, is that um, it is so important to not feel like the guilt and shame associated with caring for yourself. And I love that you used faith and a Bible verse there, because we have to think about, it's so important to think about it in a way that, if you're not religious, so I'm Christian as well, but if even if you're not religious, you think about how your best friend would want you to feel, or how someone who loves you would want you to care for yourself, you know. So if you think about, like, how a higher power, or God, or Jesus, or how whoever that you loves you, how would they want you to care for you, right? So if you can't even find it to care for yourself, think about how that best friend would want you to care for yourself. Or you could even think about it as, like, how would you want to care for yourself as a child, right? So you could think about, like, hey, I'm Magda, but I'm also a child in spirit, right? So um how would I care for my 5-year-old self? Would I tell her to feel bad for taking time
Hmm.
to take a break, or taking time to go for a walk, or taking time to journal, or taking time to take a long bath? No, I would encourage that for her. I would encourage her to take care of herself. So if you can't find it in yourself, um, to just take that time for yourself because you feel like, oh, there's so many other people that are needing, right? So, and this time we really think about how there's so many people all around the world that are needing, right? That are hungry, maybe are going through struggles, and you think about them, but you also have to think about, yourself and not feel guilt or shame, and caring for yourself in meaningful ways.
Yes, yes. Very, very profound points. Now, my
Mhm.
next question to you is if someone's watching, like, yeah, I'm okay, I got it. Self care, I'll make it a priority this season in my life because I know it's important for me to be able to function in all the capacities that I do. And they're saying, well, I don't do nails. I don't like people touching my body with massages. So, are there examples, easy, budget friendly self care tips? Like, what are examples, Doc?
Yeah, so this is for me too. I mean, I get my nails done occasionally, but it's not something that I get done regularly. So it's finding what works best for you. And a lot of self-care is free. I think one of the best places to start is here, like, kind of thinking about, those thought like how do I manage my thoughts? That's key, right? So we talked about getting up in the morning and meditation, prayer, journaling in the morning for 10 minutes, or thinking whenever I have a thought that's not serving me, that's a negative thought, or I realize that I'm putting my brain is going to a cycle of guilt, shame, blame, or um uh, or thinking in absolutes like, oh man, I always get these things wrong. I never do my work enough time. I'm always procrastinate. So those type of negative thoughts, nip them in the bud. As soon as you see them come up, you're like, oh, that's not true.
That's right.
I that's not true. It's not true. So
Oh, Dr. Makda, you're mute.
okay,
There
I
we go.
fixed
We can hear
Sorry
you now.
about that.
No
So a
problem.
lot of times if our brains are not active or if we're not engaged in like activity, uh, our thoughts may ruminate on the negative, right? So it's very important to nip those in the bud and to move it towards something positive, right? So that's key, right? So I would say that's like number one. And then engage in meditation, gratitude, journaling, and try to create these habits. Exercise, even 10, 15 minutes of walking outside. Maybe during your lunch break, you can walk for 10 minutes. You can be intentional about what you put into your body, thinking about foods that may be more healthy for you, drinking more water. A lot of these things are key. It's not just, oh, I want to spend money on a spa, I want to spend money on getting my nails done. It's a lot of the inner work, right, that we have to do, and the habits that um, help your overall well-being. And I think also sleep is so important.
Mm-hmm.
So monitoring that, creating monitoring sleep is so important too, and making sure you're sleeping at least 7 to 8 hours if you can. Scheduling your bedtime and trying to have a consistent bedtime. Those things are very much self care.
Awesome, awesome. Now, so I have someone who's watching who say, "Well, that's good. It sounds like I have to carve out more time to do these things, but I already take care of maybe two elderly parents, and so what are tips for someone who's like, I think many people fall into that category. But what are tips for someone who's like, okay, I'm not sure I have the time. What would you say to that to encourage that person?
Okay. So the first thing I will say is if you do not make time for your wellness, you will make your time will the time will be made, right, for your illness, right? So it's very,
Mm,
very important to carve some
wow.
time for your well-being, right? So if you don't add that time, it's going, unfortunately, it's so important to fill your cup. And you'll see that time come back in terms of burnout, stress. If you do not fill your cup, you may get more stressed, you may have burnout, so it's so important to make it a priority. I would say, and it doesn't have to be so much time. We talk about simple things. So it could be, I want to wake up 10 minutes earlier in the morning so I can meditate and I can think about 5 things I'm grateful for. Um, I am going to set my bedtime an hour earlier instead of staying up later to watch my favorite show. I'm going to record it and watch it on the weekend, and I'm going to go to bed at 9 o'clock, 8 o'clock, whatever fits that you're so that you can get enough sleep. Instead of drinking soda or soft drinks because it tastes good, I enjoy it. I'm going to change to water because these are small things. It's small things that you do that you know that you're caring for yourself and for your health overall. Um, I'm going to make an effort to make my routine screening appointments, right? I'm going to call and I'm going to make sure I have all of my doctor's appointments set, my
Mm,
dentist appointments set.
mm,
That's self-care, right?
mm.
So skipping out on those things, it may affect you in the future. So it's very important to make the investment in yourself now for your future self.
Yes, please be encouraged. This is not another thing to do, it's another thing to prioritize. Your
Mhm.
body would take what it's owed. I've learned that the hard way.
Yeah.
So please. And
Mhm.
Doc, I want to also kind of talk about this too. Sometimes we have to ask others to help us in our self-care. One of the things that COVID really exposed is how much I thrive in the company of other people. And so I would find that I couldn't hug my patients, I couldn't do a lot of things. And I thought it affected them primarily, but it affected me. So I learned through that season to actually ask for hugs. My daughter is a beautiful hugger, and I would kneel down and we would just hug.
Mhm.
I love hugs. So asking for things that also are important to you, and not assuming that people are just selfish and not thinking of you. It's just you've normalized not taking care of yourself, and so they just assimilate. They're like, oh, she doesn't need. So ask for what you need.
Mhm.
Mother's Day is coming. Give them a hint. I would like this for Mother's Day. I would love if you spend some time with me. Yes, we would like them to do that spontaneously, but hey, it's your self care. You ask for it. What would you say to that? Because sometimes I feel we don't like to bother people, but if we're advising people around us, we're saying, "Oh, you should have asked me for help." What would you say to that? Asking or involving others in our self care.
Yeah, I think this yeah, the idea that we can do everything by ourselves, it's a trap, right? So we are not, I mean, it really is. I mean, we all need a team. We all need love. Humans are very social creatures, We need each other for the most part. Even if you're the most introverted person, you can't function by yourself, right? In isolation. So we need each other. And part of being in community with other people is expressing our needs and wants and relying on each other to if you don't give people the opportunity that you need them, then they 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 will not be able to be there for you, right? So you have to express your needs. So one thing that's important about that is you have to know what your needs are. So that's the key,
Mm,
right? So
mm,
you have to do that assessment. So you found out that you like hugs, some people which is great because some people don't know exactly what they like, but they know like, oh, these are the things that make me feel better, but they don't know yet. So you can make a list like, oh, I really like when this person comes around. This person maybe I may not enjoy as much, So you kind of have to do an assessment of what what situations make you feel better, or what situations or activities drain you, right? So getting the hugs is really helping you. Um, going to the movies is helping you, or something having a conflict is draining you, and how do you manage it so that you have a little bit more balance, so that you have, if you have to do something that's draining you, you're also doing something that fills your cup, right? Because we're all going to have things in life that take energy, and we're also going to have things that happen that can fill our cup. But as far as more specifically, it's important to ask for what you need. you know, if closed mouths don't get fed, right? So
Like that.
so it's important for us to ask for what we need. And it's so hard, especially once you become maybe a physician or you feel that, I'm a little older, I'm a mother, or I'm supposed to be the one giving,
Mm,
but that, but
mm,
it's but
mm,
that's
mm,
that's not
mm,
true. That's not true at all.
mm.
It's a trap. You're supposed to communicate and be reliant upon each other, right? So even if someone may not have the same income as you or education as you, they have different education and different things that they can bring and help you with. And it may not be if you do have family, that's a blessing that they can help you. And it's important to rely on them so that they feel that satisfaction. You're denying them. So if you feel that you cannot ask for help, you're denying your family the opportunity to say, "Oh, when I was young, I was there for my mom. I gave her a hug." Of course, not to an overextent, right? But to the best of their capability. Like, "Oh, I was always there for my sister, my brother. When she needed me, I was there." So it's nice to be able to have that for family or for your loved ones, right? So it's important to ask, and it's important to ask before things get
Mm,
too bad, right? So it's important to ask in the beginning, right? Before you have to dig out of a larger hole, right? So the more you ask, the more you fill your cup before you become more irritable or you have different issues with
meltdown.
sleep or burnout or stress. It's important to start as early as you can, but of course, it's always better to start when you can.
Yes. And I love what you said. So for those who are watching who are like, oh my goodness, you don't know my family, you don't know my this. Okay. Write a list first of things that fill your cup, that things that add joy, little sprinkles of joy in your day. Write them out. And then we'll go about as you start to write them out, that you recognize them when they come and you take it. All right. Doc, this has been so good. We're going to do a part two, definitely, because time is far spent. This has been very enriching. They sound simple to do, but please, I want to encourage you, please share this with those who could find this useful, because this actually helps you live out your best version, your more focused version, your more filled up version. And then you're able to show up in all the capacity as a mother, as a caregiver, as everything that you are, a teacher. You're able to do that even better and impact your world. So I have people who are watching, Doc, who are
Mhm.
like, man, I like her. She's in Florida. Where? She's in Florida. I know people who could reach out to her and connect with her, have her come speak. Doc, for those who are watching live and those who will watch replay, where are you and how can we find you?
Oh, well, it's really, really been a pleasure to speak with you, Dr. Tola, and all of you that are watching today. And you can find me, I'm in Miami, Florida. You can find me. First, I want you to pick up the tips, which Dr. Tola is going to link. So it's if you click on the 5 tips that you can start today, I'll send you a checklist of tips. Um, I am on Instagram at Doc Majette, DOCMAJETTE. And I'm also on Facebook, Makda Majette, and I'm on Twitter as well at Doc Majette. So you can find me in all those places. And I really have enjoyed this talk, and I look forward to future talks. Thank you so much, Dr. Tolu.
Oh,
And
my
thank
pleasure. My pleasure. And likewise. And for those who are watching, I've put the self care tips she talked about at the bottom of the screen and also at the comment section. And the website is also at the bottom of the screen for those who are watching on Facebook and those who are watching on YouTube. Okay. But thank you all for watching. Thank you, Kelly, for joining us live. And for those of you who are watching who cannot see your faces, thank you. Please share this. Caring is sharing. You can
you.
improve the lives of people around you just by forwarding this video to them. So please do so. And if you or anyone you know is looking for an awesome, a thorough, and a passionate family physician who will help you live long and well and have conversations like this, I am she. Have a good one. Thanks again, Doc.
Goodbye.
Bye.